Okay, Dave, let's go ahead and get started then.
Okay.
I'm going to hit your button.
I just hit it, so we should go live now.
All righty. Hello, I'm Rick Steele, and I serve as the chairperson of the Licensed Psychology Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and by other electronic media. Bruce Nystrom. Jonna Norton.
Here.
Abby Callis. Carol Crane.
Here.
Janine Kesterson. Monica Carrillo.
Here.
Rodney McNeil.
Here.
And Doug Wright.
Here.
I note the following staff members are also present: David Fye
Here.
and Leslie Allen.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as no individuals requested to provide public comment. Because we are conducting the public meeting remotely by conference call and other teleconference ability, I state for the record the following information. This meeting is being conducted remotely. However, access to the meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is being conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting the meeting pursuant to KOMA. On July 1st, 2021, we sent notice of the advisory committee meeting to all individuals who requested notice of the advisory committee meeting. The notice was also posted to the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials will be posted to the board's website on the day of the meeting. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line "Request for the Agenda," and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240. The recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda.
Thank you, David. The meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, which is agenda approval. I believe you've all received a copy of that via email. Do I hear a motion to approve the agenda?
I move we approve the agenda as written.
A second.
Thank you, Dr. Crane. All in favor?
Aye. Aye.
Any opposed? Okay, motion carries. The next item is the approval of the minutes from our meeting on June 8th, 2021. I believe you received a copy of those as well.
And Rick, I would ask for a friendly amendment after we distributed the minutes. We found an error. Janine Kesterson was in attendance at that meeting. And so we would just ask for a friendly amendment to go ahead and add that she was present during the meeting.
All right. Thank you for catching that. I missed that when I reviewed them. Do I have a motion to approve the minutes as amended?
This is John. I'll make that motion.
Thank you, John. Is there a second?
I'll second it.
Okay. All in favor of approving the minutes as amended, please signify.
Aye.
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 Any opposed? Okay, the minutes are approved. Next, we're just moving right along here. Next is the executive director's report. So I'll turn it over to you, David.
Okay, thank you, Rick. So I just wanted to update the advisory committee on a few items. When you last met, that was back in June, and we were at a state of uncertainty concerning the states of emergency related to the pandemic. Since that time, the state of emergency in Kansas officially ended as of the June 15th. And we were advised by the Office of the Governor to have staff return to the office as of June 14th, which was Monday, June 14th. And Rick, Abby Callis just entered the waiting room. So just wanted to let you know she's also in attendance or will be here in about a minute or so. Okay, I'll go ahead and continue. So the state of emergency did end back in June in Kansas, and staff was advised to return to the office full time. We had a number of staff who prior to that time had been working at home the majority of each week. We were given the option to institute a telework policy. And so if we did do that, it had to be approved. We went ahead and put together a telework pilot program, which we're going and using through the end of December. We are limiting that to just a handful of employees right now. And we are collecting information to see how that goes. And then if it is productive and it has the results that we would like, we will consider expanding that to other employees. So prior to last week, we had been receiving information from the governor's office that if you were vaccinated, you no longer had to social distance. You didn't have to wear a mask when you were in the office. However, now we have received information that as of last Monday, the governor's office did direct all state employees and state buildings to go ahead and begin wearing your mask when you're around other employees, and also to begin go back to the process of social distancing. So the last time the board met in July, there were plans to have the next board meeting in person in the board office here in Topeka. However, due to those safety concerns, that meeting is going to be moved back to Zoom. We are hopeful that the full day meeting that the sometimes referred to as the board retreat, that is on September 27th. We're hopeful that we'll be able to still have that in person. So we're looking at different options to be able to space or what options we have, but that may need to move back to Zoom if we're not able to do that or if things don't improve. In terms of some other issues, the budget for 2021 was complete back at the end of June. Just to let you know, as a big picture overall summary, revenues did come in slightly above what was previously estimated for 2021, and that was good. The balance in the BSRB fee fund was right around $2 million. We are currently operating at a bit of a deficit each year by design because the balance in the fee fund had grown over $2 million. Back in 2019, the board instituted some licensure fee reductions to have that essentially the ending balance reduce a little by little over a period of years. So the good news is that even though the revenue fluctuated wildly between month to month, in part due to some of the executive orders which stayed the enforcement of the expiration dates. That ended at the end of May. And so we did collect more revenue than we generally do on a month-to-month basis prior to the end of the fiscal year. So big picture, we did come in just above what was already predicted for 2021. And so the balance in the fee fund is still dropping, but it's dropping at a slower rate that even we had projected. So it is a little under 2 million now, and we'll continue to monitor it. The cost and were a little bit lower than previously estimated. Part of that was some savings related to the pandemic. And so we're in good shape budget-wise. Going forward, we will need to submit the new revisions for the budget on September 15th. So I've been working with the governor's office and the division of budget in terms of how to go about that process. We did get an initial budget approved already for fiscal year 2022 and 2023. So these will just be adjustments to the already approved budget. And then one other item on the budget is that I've been working on a number of end of the year fiscal reports. Those don't involve us to a great deal because a lot of them involve federal funds, which we don't receive. We did receive some PPE and other items like that, but it was paid for by other agencies, and then we received those products. So that's how it was billed. A couple other items. Last time we spoke, we talked a little bit about a bill that was passed by the 2021 legislature. It was House Bill 2066. It had to do with expedited licensing timeframes for military members, military spouses, individuals seeking to reside in Kansas, and some individuals here in Kansas. It primarily affects reciprocity applications. And so Leslie went ahead and made a number of modifications to our reciprocity applications. We've been answering questions from individuals on the implementation of that bill. We've also talked with our licensing software providers from the Board of Healing Arts to make sure that we are tracking those totals. Because at the end of the year, we will need to provide reports indicating how many individuals fell in that category and how well we did meeting those new timeframes. Just one other item too. So I was able to attend a conference here in person this last weekend. I was in Denver, Colorado for a counseling regulatory board annual summit through NBCC. Most of the things that I've been able to attend so far have been over Zoom, but being in person, that experience was irreplaceable. Developed a number of good contacts in other states. So I plan to continue to do that. I think it's a really good source of being able to compare what we're doing here in Kansas to what they're doing and looking for efficiencies that they're using, trying to look at any problems they may have experienced that we haven't yet. And so we can put something together in place before that. So that was very, very productive. I am planning to attend the annual meeting of ASPPB, and that is going to be Friday, October 15th and Saturday, October 16th, though that will be virtual. And with that, I will conclude my report, and I'd be happy to answer any questions.
David, I just had one quick question in regards 2066. Do I remember correctly that as a result of that, there was going to be maybe a part-time, an additional part-time FTE person in the office?
Yes.
Is that underway?
Yes. So we have been talking to the Department of Administration's office, and we actually did have a member of our staff resign just late last week. So I think what we will be doing is we're going to try to change some things around a little bit. We are still going to be filling that part-time role, but we've had some internal conversations, and I think we're going to try to redistribute some responsibilities for a new person coming in for both of those roles. And so that is still the plan, but this has made things a little more complicated, but we are still moving forward on that.
Okay, thank you. Any additional questions for David about the executive director's report?
Yeah, this is Monica. So Dave, thanks for representing Kansas at ASPPB. I'm hoping maybe we get an update from their SCIPAC Commission on approval of Kansas into that. I don't anticipate that's going to be a problem, but I think we're all kind of excited to hear about that. So hopefully you're planning on letting us know.
Sure. Yeah, and I can provide an update for that just a little bit later in the agenda today.
Cool. Thanks.
Any other questions? Well, then it may be time for that update on the SCIPAC Commission there, David.
Great. Yes, so just a reminder, SCIPAC, it is also known as the Psychology Interjurisdictional Compact, and it is a multi-state compact which allows licensed psychologists, PhD level psychologists in member states the option to obtain an e-passport through SCIPAC, which allows the ability to practice an unlimited number of hours of telehealth within compact states. There's also a way to do a different type of process through the SCIPAC Commission, and that would allow a number of days of in-state practice, but it's limited to about 30. The majority of people who practice under SCIPAC are doing the telehealth. But the legislation to join the multi-state compact for SCIPAC did pass in Kansas during the 2021 legislative session. The legislature did enact that bill, and the language in the bill indicated that Kansas would join SCIPAC as of January 1st, 2022. And the last time that I spoke with the advisory committee about SCIPAC, I indicated that SCIPAC had reached out to us asking if, so even though Kansas wouldn't officially join the compact until January 1st of 2022, each state has a delegate or a representative. It's called a SCIPAC commissioner, and each state has a SCIPAC commissioner for their state, which represents the state as part of the SCIPAC commission. And they indicated that while we wouldn't be officially in the compact until the January 1st, 2022 date, we could go ahead and have someone assigned as the Kansas commissioner to SCIPAC. And so at the last advisory committee meeting, you made a recommendation that I be selected for that position to be the commissioner on behalf of Kansas. And the board meeting in July, on July 12th, the board went ahead and moved to make that official, that I become the new commissioner to the SCIPAC Commission. So we did notify SCIPAC, and that is in place. So even though we don't have official voting powers until that January 1st date, we can participate in discussion at meetings after we name someone as a commissioner for the state of Kansas. Additionally, when the SCIPAC legislation was enacted, there was some language that would allow for the board to charge a fee of up to $25 at the time of licensure or renewal for any individual participating in SCIPAC who lists Kansas as that individual's home state. You may recall there was an assessment that was going to be charged by SCIPAC to the state of Kansas. It was a $10 annual charge that SCIPAC would charge the state of Kansas per licensee who listed Kansas as their home state. And we will be working as an office with SCIPAC on some of the coordination. So at that July 12th board meeting, the board was asked if they felt confident to go ahead and decide on the amount of the fee within that $25 limit. And the board decided to go ahead and set the fee at $25. And so that amount has been set, and we're working on regulatory language. And once that's ready, it will be put out and made public, and individuals will have a chance to provide comment on that. The annual SCIPAC meeting will be in November. However, there was also a mid-year meeting that SCIPAC went ahead and held this year. Generally, there's just one big meeting. There's some other committees that work for SCIPAC, but they went ahead and had a meeting on August 5th. And I went ahead and spoke with the representatives from SCIPAC concerning this meeting. There were a number of things that took place at this meeting. So essentially, any states that had legislation where they had additional language beyond the Model Act, the SCIPAC Commission discussed those changes to see if they were significant enough that those states would not be able to participate in SCIPAC. Some of the states that fell into that category were Alabama, Arkansas, Kentucky, Minnesota, and West Virginia. And just to give you an example of one of the differences, so in some of the language of SCIPAC, it indicates that if an individual might have to sue SCIPAC, the jurisdiction was going to be that the lawsuit would need to be in Georgia. But under the state constitution in Alabama, it required that the jurisdiction for an Alabama resident would be in Alabama. And so without that change, they would not have been able to be a participant in SCIPAC. And so the SCIPAC Commission went ahead and said, even though there's a change, it's not significant enough to keep them out of the compact. So 3 of those states were granted in, and then 2 of the states, they found that the language was too different. And so they would ask that those states make changes in their statutes prior to being admitted. Given the $25 fee, I did ask the representatives from SCIPAC if that would be language that might, put Kansas in jeopardy because it's not part of the model language. And they did say that they were aware of the $25 amount, but because it was only affecting the individuals who listed as their home state, that it wasn't something that applied to everyone who participates in SCIPAC. It was limited, and it was limited to essentially recouping the cost that SCIPAC would be charging the state. They said this was not something that would keep Kansas from being part of the commission. So just one other update in terms of the SCIPAC meeting is they also discussed there was going to be finalization of a new commissioner training guide. And that training guide is going to be distributed here soon. It clarifies the role of each state's commissioner, as well as provides information about the bylaws and rules and regulations. So as someone coming in new, I'm very looking forward to that document. Also wanted to call your attention to one item that I included in your packet. So there is a quarterly newsletter from the SCIPAC Commission. This one came out July of 2021. It includes a little bit of message on different items in SCIPAC. And there was a nice welcome message to me and a few other individuals as recently named commissioners. At the back, it indicates the breakout per state of individuals who are participating in the SCIPAC multi-state compact. And then it also shows the growth per quarter. So you can see how many new individuals are coming on board in those SCIPAC member states. So SCIPAC is moving forward. I did receive a few questions from individuals, whether Kansans who are interested in participating in SCIPAC can go ahead and pre-register. with the SCIPAC Commission prior to that January 1st date. And I was informed by Janet Orwig, the director of SCIPAC, that because of the implementation date of January 1st, because Kansas is not officially in the compact yet, individuals will need to wait until after that date. But as of January 1st, they can submit their materials to be reviewed, and if they're interested in participating in the compact.
Perfect. Thank you, David. That is fantastic. I got to tell you, from the medical center perspective, here in Kansas City, we're extremely excited that we're going to be able to have SCIPAC active, and just anticipate that you're going to get a whole lot of sorry, but you're going to probably get a whole lot of applications for that once it becomes active in January. At the very least, from the medical center here in Kansas City. We have required our practitioners, because so many of us are doing telehealth, at the very least into Missouri, that we get Missouri licenses, as you all may know. But this will allow us to be able to do telehealth into other states where we have patients currently. So thank you, and appreciate your service as commissioner on behalf of Kansas as well.
You're welcome. And I think we'll go ahead and put out a notice as we get closer to the implementation date, just to give some details, because I think there will be a little bit of confusion with SCIPAC being a separate entity from the states. So we are working in coordination with the SCIPAC Commission, and we are sharing certain information and verifying information. But we'll put some updates on the website so people will have some good information about where to submit information if they want to participate in the compact.
We've already had requests, Monica.
I know, I've tried to calm them down. I'm sorry. They're just extremely excited.
Okay, thank you. Any other comments about SCIPAC? Great. Then our next order of business is to take a look at the applications and letters, or the CVs and letters of interest for those people who expressed interest in being a member of the advisory committee. You'll recall that the office sent out a call to all licensees, well, all psychologist licensees in the state, identifying the specific roles of the advisory committee, as well as what we had identified as potential target areas in terms of professional settings and whatnot, as well as the preference to have someone to further diversify the board. We got 7 statements of interest, and I believe you have a table that I put together that just kind of sketched out a little bit of information about each one of those 7. And I believe you all have had a chance to review the CVs and letters of interest from all 7 applicants. David also provided yesterday, I think, how would you describe that document? I'll let you talk about that document, David.
Okay. So there's a number of advisory committees right now that are looking at, they're having advisory committee members who are coming up on the end of their service. There's a limit of being able to serve 4 2-year terms. And there have been a number of questions on the process that is in the board governance policy document. Some of the jobs of the advisory committee members, as well as how the advisory committees should be structured according to that board governance policy. So that document that I did put out, it does talk about the advisory committee's responsibility of supporting the work of the board and also fulfilling the mission of the board in terms of protecting the public. It indicates that there is a process to be followed when looking at advisory committee applicants, and that those do go to the advisory committees for discussion. It talks about the size of the advisory committee. It indicates that according to the board governance policy, You have in this case, the two members of the board who represent licensed psychology. You also have a public member on the board. And then for those non-board members that sit on the advisory committee, the board governance document indicates there will be a minimum of 3 additional members appointed. It doesn't talk about a maximum, but from my conversations with individuals historically, there's sort of been an unofficial guideline to have no more than 10 non-board members on the advisory committees, but those numbers do tend to be closer to about 5 to 7 in most cases. They do ask that the terms be staggered. That way, not everyone comes up at the same time when we're looking to replace advisory committee members. As you mentioned, there were certain criteria that the board governance document talked about, and also there was additional criteria that the advisory committee specifically was seeking in terms of different professions and other items. And that information was put out in the message that we sent out from the office to all the licensees, asking them to nominate themselves if they wish to participate on behalf of the advisory committee. And so, as you mentioned, those have been distributed to the members of the advisory committee for review. It does indicate that the advisory committee will review the nominations, and they should look for those certain criteria that were in the message that was sent out, and also that there would be discussion. The historical preference or precedence has been that the advisory committees would review those and then would come up with recommendations on individuals that they wish to have serve on the advisory committee going forward. Officially, based on the board governance document, the person who has the authority to add or remove members is the chair of the board. But how it has gone in the past is that members of the advisory committees have discussed those individuals who were nominated, have reached recommendations, and then the individuals who were recommended, as well as the other nominees, essentially are forwarded to the chair of the board for review. And it says that prior to the chair of the board appointing members to the advisory committee, it says that the chair can seek discussion. And I guess one thing I should have noted earlier in my updates is that the Behavioral Sciences Regulatory Board does have a new chair. That is Leslie Seawester, and a new vice chair, and that is Dave Anderson. So, based on what the board governance document talks about is that you'll review these nominations based on the historical precedents, you'll make recommendations, and then that information will be forwarded to the chair, and the chair can seek further input. And then at a board meeting in the future, the chair will go ahead and make the official action to add or remove members from the advisory committee.
So given that there is no upper limit to how many members we can have, I think maybe a place to start is to decide how many are we wanting to add, or what do we think is appropriate? Or is there a number that you have in mind?
I agree, especially because we're staggering, we're hoping to stagger the number of members. It wouldn't be advisable for us to have all 7 of them included. So, and then I noticed that we have 3 from military kind of backgrounds. So maybe that may be an option to just select from those 3 applicants.
Well,
as to who to rule out, maybe.
yeah, I think we have latitude here. I mean, there's no reason to think that we need to add too many. And it may be that we want to, Doug, like you said, pick a specific number. I think another way of going is to look at those people that represent things we're hoping to bring to the committee, and then in going that direction. If we happen to find 2, great. If we don't find 2 and we just find 1, who find, so I guess as far as I'm concerned, I'm less worried about a specific number. I don't think we need 7, right? That would be unwieldy at the least. We're losing 1 of our current number, and so if we were to pick 2 or 3, I don't think that would be unreasonable, but I don't think we have to pick a specific number. That's kind of just my take on it. I feel like it would be best to go the direction of picking the persons we want, rather than feeling like we have to either eliminate people that we would like or take people that we wouldn't necessarily want to work with. But what are other thoughts?
Yeah, I think that was a good summary. I would lean towards looking at those who fill some of the needs that we have and starting there, because it may turn out that we plug 2 or 3 holes and then problem solved.
Mhm.
And I'll mainly limit my role in this discussion to helping to facilitate and some of the mechanics. I did indicate this, I believe, in my message, but in case I didn't, one thing that I've been doing for each of the advisory committees is I've been doing a check on the individual applicants. So any individual person who submitted materials, I did do a check to verify that this person does hold an active license. So I can verify that. But aside from that, after I verified that they were all currently licensed, that's the role that I limited myself to on this. And I thought that I would try to stay neutral in this discussion, but if you have any questions on the mechanics, I'd be happy to add anything on that.
And I can look up on my phone if they have disciplinary action, if you're interested in someone.
That would be good to know. Because we don't need that. So we had identified 4-ish kind of work settings that we felt like would be important to include. We listed VA specifically, we listed corrections specifically, we listed medical rehab, and we also listed community mental health. Of those, I believe we have current members who are in community mental health. Monica is currently the only person technically in a medical setting, I believe, unless someone forgive me if I'm misspeaking there.
I think there may be you might want to consider a difference between institutional, like VA institutional, and institutional like academic medical center institutional. Sometimes
Sure.
there's very
Yeah.
subtle differences between the two, and you can really find some helpful opinions that differ between those two settings. Also, I think rehab/health would be good. And just to be transparent, Zach Parrott is actually a former postdoc of mine, and he did a great job. And I actually did not recommend that he sign up, but was very glad to see that he did. So I can vouch that he would be a great person to work with, and so would Jessica Hamilton. Those two people. I do not know your dog, however. I do know my cats.
Was the dog in favor of what Monica just said, or opposed to what? I could not.
I think that was a favorable bark. I'm pretty sure.
Okay. All right. I just wasn't sure. I know how to read my dog's barks, but not other people sometimes.
Yeah, that was a favorable one. We're safe.
Okay. All right, good. Okay, I think that's a good point that Monica brings up, is there would be a different set of contingencies around the workplaces represented by the VA and more of an academic medical setting. Sometimes in some locations, of course, those are kind of knit together, but I don't think that is the case in the applications we're looking at now. So if we go with thinking initially about rehab, medical, and VA, what are some other thoughts? Monica said that she could kind of vouch for Dr. Parrott. I'll tell you that when I looked at his CV, he's one of the people that I thought would be a potentially good member. He was in my top group. He mentioned, so if we go down the kind of the criteria we had outlined, he is in a VA. He does also say he works in a rehab kind of health and suicide prevention area, which I think is beneficial. So it's almost a twofer one kind of a thing, VA plus health and rehab. He did note, he made a comment that he hoped to further, to facilitate further diversity of the committee. That's what I know about what he said, and that's all I know about that.
So Rick, you have no idea of in what way?
I don't know. That's, you know, with, unless people specifically identified as being a member of a particular community, that I did not do a Facebook or Google search on any of these folks to see if I could sleuth out. That just felt a little unseemly to me. But
Mhm.
I'm not
Do you want me to
judging.
fill in the blanks?
That might be lovely, Monica, if you have something you'd
Okay,
like to share.
I can tell you that he is a white male. He has two beautiful sons, and he got to be on the sporting KC ads before me, so I was like totally shocked about that. Apparently he looks better in pictures than I do. And I think in terms of diversity, he probably was speaking to rehab as the diverse piece, because there's not a whole lot of rehab psychologists in Kansas. So if I had to guess, that's probably what he was referring to. But I also want to say that his first postdoc before me was a child postdoc. So he also has a range of experience in terms of ages of folks that he's worked with. So he has some diversity of experience that way too. So I think it was more probably diversity of experience more than anything.
Thanks. I appreciated that he addressed I mean, you know, not everybody even really addressed it in their cover letter. So I appreciated that he had something to say about that. So that's helpful.
I'm glad you mentioned the part about him having a child background. I don't know if there's anybody else on the committee that currently, other than myself, works with children primarily.
Dr. Steele is, I think, right?
Who?
Dr. Rick.
Oh, that doesn't count.
Okay, well, that's how we're gonna go. Great.
No, but in all seriousness, I look at, you know, my future and I think, oh, it would be nice to have someone to backfill that beside Rick.
I'm child community mental health only.
Okay.
And then, and just in terms of like, while we're weeding through people, Robin Finkbone, I work with her. She's also child community mental health. She's at family service. So that may be too duplicative, but I mean, she's amazing. And I'm not sure that that's exactly what you're looking for right this second.
Okay. So any other, since we have been talking a little bit about Dr. Parrott, any other comments from your perusal of his letter or his CV? Okay.
I will say he was in my top group as well. My top group, the top three, I would have had Dr. Parrott, Dr. Johnson, and Dr. Hamilton. Just trying to fill the niches that I felt that we needed in our committee. And so for what it's worth, I don't know if others want to, maybe they had different ideas, but that's just kind of where my mind went, trying to fill the gaps that I felt we had.
I had the same list.
Yeah, I did too.
Yeah, that's funny. Same.
Okay, I think we've got our three that we need to choose from now.
Okay.
Let's just cut to the skinny.
We can stretch this out as long as we need to. I mean, we can talk about, I mean, I've got, you know, classes don't start for 2 weeks for me. We can talk all night.
I technically had 4. I also included Dr. Johnson, but the other 3 were also on my top ones. So that's pretty cool.
For my list, I had Parrott, Johnson, and Finkbone, but Hamilton was on the top too, depending upon what areas we felt we needed to fill.
Okay, so if I'm making sure I'm got my notes correct, so everyone had Parrott and everyone had Hamilton, or in their top-ish group?
And Johnson.
And
Johnson.
Okay, and Hamilton and Johnson. Okay. Okay, are we cool with limiting discussion then to those three for the rest of our time?
Yeah.
Okay, sure. All right, so we have someone in the VA system, someone at KU Med, and someone at a state hospital. No one else among us is at a state hospital. Or
That's why that one stood out for me.
yeah, that occurred to me as well. And she also reports that she's a Black American professional, which is important, and works with, it looked to me like she worked with a population at particular risk. And I think we had talked about one of the criteria is someone with experience working with diverse and vulnerable populations. Not that all of our populations aren't vulnerable to some degree, but you know what I mean, right? So we have a decision to make about whether we have a decision to make.
I don't want to make this sound as if you need more people because I'm leaving, but that is not the case. But I do think that that you would benefit from extending an invitation to all three of those people, because I think they each would bring something very unique to your group that would be really helpful in your deliberations. And I can also tell you, I don't know about Tiffany, because honestly, I don't remember what year she graduated, but the other two are late in the early career stage. So they're just kind of their early career going into mid-career pretty soon. So that's a good perspective to have as well, I believe.
David, unless are you, in terms of mechanics and process and kind of standardization across professions, would adding three, well, technically adding two to the total number, would that make us unusually large relative to the other boards or the other committees?
Well, so I think you would be slightly larger than most of them. But so the only advisory committee that has met so far in terms of discussing adding new members has been the Professional Counseling Advisory Committee. And that advisory committee doesn't have anybody coming up that is due. However, I think there are 6 non-board members on that, and they had 16 applicants. And so they decided to try to schedule another meeting at the very beginning of September to allow their members to really go through all of that material. But I believe based on their discussions, they were planning to add at least 1, if not more members, which would bring them to about the 8-member threshold. So I think at the moment, it would make you a little bit larger than some of the groups, but I don't think that will stay the case after this round of adding members, if that helps.
Okay. I'm comfortable with giving those 3 recommendations to the chair of the board.
I would be in favor of that.
Yeah.
As would I.
Agreed.
Me too.
Me too. And just as a what's the word I'm looking for? To do a due diligence, Leslie is still going to look at any potential issues regarding the background, but otherwise, I don't see, like, all of the CVs and cover letters well done. So, yeah.
Okay, do we need an official vote, or is this a consensus kind of a thing?
So I think consensus would be fine. I just wanted to clarify one little thing too. I talked about it earlier, but it's a little confusing. So the board governance document does indicate that individuals can nominate themselves. And historically, the advisory committees have had discussions and have decided on individuals to be recommended for to be added to the advisory committee. The board governance document says nominations will be forwarded to the chair of the board. So I think to comply with that language, what will probably happen will be the chair of the board will receive the names of these individuals that are recommended by the advisory committee, as well as the other individuals that nominated themselves. So the chair will get the full list of nominees, but it will be noted that the advisory committee had discussions and selected these 3 individuals as the ones that they had nominated to be considered of the entire group of nominees.
That sounds good. If we can just add a pending Leslie's due diligence on making sure that we don't have anyone with a record.
I'll get the people from Dave tomorrow and take care of that.
Well, and if there is still time, the next board meeting is September 13th. So if you wanted to have another meeting, a quick meeting right before the board meeting, we could try to go ahead and schedule something. So
If we found out that someone had a criminal background or something that would prevent them from, yeah, I would be surprised.
What about current advisory committee members? Just kidding.
Are you trying to tell us something,
Just
Monica?
kidding. No, I can, well, like I said, I can vouch for Jessica and Zach. I highly doubt either one of the case.
Okay, well, it sounds like we reached consensus on that much quicker than I expected. So that's fantastic. I feel like that's a good list, and we'll add some expertise to the committee that we don't have right now.
Or that may be leaving.
Yes.
Wah, wah.
So I think we're at the end of our agenda.
I have a relevant FYI that I don't know if this will be a good time to bring up. But the APA convention is this week, and apparently there's going to be a discussion on ethics code revision. There's been major ethics code revision happening to the APA code, and everyone is invited to a Zoom discussion at noon. And I could send out the information, but I just want to bring this to your attention just in case it has some bearing on how we run things. Would that be okay for me to email that a little blurb of information that I got regarding this discussion over Zoom? Everyone is invited. You don't even have to enroll in the convention.
Sure, maybe you could send that to David, and then he can send it out to the committee and other members of the board who might be interested.
I'd be happy to.
Yeah. Thanks for
Thanks
that.
for that reminder, Carol.
Just real quick. So if anyone from the public requested that information, we would have to give that out. It would be a public record.
I received the information from APLS, which is a division of APA. So.
And you said it is an open, you don't have to have registered for the convention in order to attend that session?
That's correct.
Okay, yeah, I don't think there would be a problem there, right? So anyone could join, anyone in the public.
What time zone is that?
They did say that it's for the general applied psychology division, and it included, I think, 13 different divisions who are under the general applied psychology, including APLS, but consulting psychologists.
Yeah, division 53 and 54, and I think maybe I saw.
53 and 54 are not explicitly included in the GAP, apparently.
Okay, well, I got an email about it from one of them,
okay.
so.
Good, that's good.
What time zone is the APA meeting in these days? Where are they meeting?
Oh, they're in this year.
Uh-huh.
Well, they were supposed to be in San Diego, but they're doing everything Eastern time, I think.
Okay.
Meaning it'll show up as Eastern time zone, I think, but obviously you can make the
Change in your head, yes.
adjustment. Yeah, and the convention is actually Thursday, Friday, Saturday, right, Carol? I think.
Sorry, what, I was sending it to.
That's
David.
okay.
What is? Can you
The virtual convention is Thursday, Friday, Saturday, right?
I only, because I'm not intending on attending the convention, I'm only pouncing on this discussion because it seems very relevant.
Gotcha.
Yeah.
Okay. I'm gonna be attending that convention. They actually moved the Council of Representatives meeting to late October around Halloween time. So we're not gonna be meeting virtually or in person like we normally would. And right now, the council meeting is going to be hybrid at the end of October. I wonder whether that might end up moving back to fully virtual, but the convention, I'm pretty sure, is Thursday, Friday, Saturday this week. All virtual. Although some of us talked about maybe just going to San Diego and sitting on the beach and joining virtually. But then the Delta variant came around and we decided against it.
All right, I think we are at the end of the agenda. Unless there's an additional business, if someone would like to move to adjourn.
I
I
can move.
move that we adjourn.
Thank you, Rodney. Is there a second?
Yeah, I'll second.
All right, and then all in favor, either signify by saying aye or perhaps just logging on.
Aye.
I figured that one out.
All right.
All right,
Just walking out.
just walking out. I mean, what are you gonna do? If we vote not to adjourn, what's gonna happen?
It's not going to be Monica's last meeting though, right? Or
It depends on how,
Maybe.
maybe, it kind of depends on things. So it depends
That
on,
doesn't mean I can't just watch you guys and stalk you.
that's true.
Ooh, you got chills just now, didn't you?
Yes, this is an unsavory feeling that I had.
Okay, I'm not gonna do.
All right, everyone, take care.
thank you.
Take
See you
care,
next
everyone. Bye.
Cheers.
Bye.
Bye.